Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community. On today's episode, I got to interview Dr. Chad Burton, who is the founder of Maven Growth, which is located in Raleigh. Dr. Chad's vision for Maven Growth has been to transform how people think about their health and wellness by focusing on the fundamental pillars of nutrition, exercise, and performance, which is countercultural to what conventional medicine usually prescribes. He and his team have taken a science-backed, holistic approach to health optimization, and they have many comprehensive programs designed to help clients specifically achieve their full potential. So whether you're looking to boost your energy, maybe looking for ways to improve your mental clarity, or perform at your very peak, Maven Growth is tailored to clients who want to get to their next level by providing a bridge between the gap in medicine and sustainable life changes. Very similar to what we try to do in Next Level Physio as well. Dr. Chad and I on the episode discuss his transition from the ER, which is where he worked, to how he optimized his own life and own health in order to become the example to help others also do the same in their lives. So I do hope you enjoyed the episode. As always, please consider subscribing to our channel to learn more about how to get the most out of your life if you are a runner or hybrid athlete over 40. Dr. Chad Burton, it's been such a pleasure getting to know you, and I think we hit it off so fast when we first met probably 2 months ago.
Yeah, I think it was about that.
Yeah, and I'm really excited to bring you onto our podcast because I felt so much alignment in how you practice medicine and how we do physiotherapy. So I definitely want to get into some of those similarities, but I want to talk about your journey from as an ER physician into founding Maven Growth. What was that turning point for you that made you step away from the ER?
Sure.
And we can go back if you need to.
Yeah, no, that's perfect.
Yeah.
Well, first off, thanks for having me here, Jerry.
Oh, man, pleasure.
To echo the sentiment, it was fantastic meeting you, and it was like right away there was traction with the viewpoint and kind of the purpose
100%.
with it, which is amazing. So for me, the emergency room was, that's a lifelong dream. I think a lot of people get into healthcare or the idea of whatever the path of healthcare is, be that physician, nursing, physical therapy, occupational, wherever it goes. Yep. I think we get in with an intention to help people and, a desire to do something positive and create change. And so emergency medicine for me was the right mix of, I think, adrenaline a little bit, for the selfish side of things, but also just it was an interesting pulse on society because whether you are, regardless to your income class, regardless what you do for a living, regardless where you fall socioeconomically, racially, gender basis, you're coming to the ER at some point in your life. And so it's this really interesting time to be able to sort of be a bit of a fly on the wall for what's happening in society. Everyone comes through there. And so you notice these trends. And I think that's an important basis for how niche a lot of things in our society have gotten, where a lot of times we go to work or we stay in our little bubble of life and we don't really come up for air all that often. And so sometimes it's hard to take a look around and see what else is going on. And ER for me was a really special opportunity to sit there and say, oh my goodness, there's such a capability for observation and these trends that I started to notice, which we'll get into that here in just a little bit, I think.
Yeah, definitely. So in the ER, you obviously there for a while. And what did you notice in the ER that most, maybe other physicians or other providers might have been missing? And why was it such a revealing place to observe bigger health trends?
I think in part it's because, especially during the COVID era, and I think maybe it's we could break down emergency medicine into like a pre and a post-COVID. And I think a lot of healthcare works that way, but I'm going to focus on the ER because it was the part that particularly remained open through all of it.
Yeah.
And so before COVID happened, you had your primary breadbasket of ER-related things. You had trauma, you had heart attacks, strokes, you had respiratory failure and decompensation from that standpoint. You had cardiovascular issues. You had your regular sort of scenarios. Post-COVID, I started noticing this influx of people that had just this profound sense of dis-ease. And we'll get into what I mean by disease here in just a little bit as well. But I think for now, what I want to talk about on that subject is the idea that they would come in and they would have like a series of symptoms. Maybe it was irregular heartbeat, racing heart, difficulty falling asleep. Maybe it was chronic abdominal pain. And, they had been already worked up a lot of times for these things. The heart people would come in and they'd have had like a normal EKG. They'd have negative troponins, a heart enzyme. They might have had a Holter monitor with like an outpatient cardiovascular sort of process. And they were still having the symptoms. And the abdominal pain people were kind of similar. They'd come in, they had had labs, they'd had imaging, they had had maybe an endoscopy, upper and lower. Sometimes they'd had several, and they were still having the symptoms. And so it was this discussion point about where's this coming from? And I'm not going to say that I'm the only one that noticed it. I think collectively there was a lot of frustration across the practice of emergency medicine, noticing it and feeling like we couldn't help. Because a lot of times the volume of people that are sick with what I'll call medical sickness, meaning abnormal labs, abnormal imaging, and need for intervention right now, they take precedent, unfortunately, especially in the ER standpoint. And so it's really difficult to find the room in like a 15, 20-minute patient interaction to unpack and say, well, what's upstream from these symptoms? And so I had a moment of clarity for me where I noticed that I wasn't doing too well with feeling like I wasn't able to help.
Yeah.
I had let some of my own personal health go. I wasn't working out to the extent that I normally do.
Yeah.
I was taking shortcuts in nutrition. Sleep wasn't really going well. And I was like, maybe there's something, how I'm feeling worse. Maybe this is like a process that these patients are coming in with and they're feeling kind of similarly. So I had the moment of kind of stepping away from it to say, hey, can I work on me? And by extension, maybe find a process to help others as well.
That's pretty powerful. Now, that must have been, I can only imagine the chaos in the ERs during that entire time with COVID and stuff.
Oh, yeah, it was really something.
I mean, just the stress of going to work, I can't imagine what that was like.
There were phases to it. And so in the early phase, it felt like we kind of talk about like a tsunami. And my understanding, I've never seen one in person, my understanding is the tide goes out before it comes in.
Yeah.
It felt like that at first because we were getting reports from, China and Europe of just absolute chaos and a complete lack of resources and overload on the patient side of things. And for us, in the early days of it, people quit coming. They weren't coming for the outpatient procedures sort of shut down.
Yeah.
They weren't really coming to the ER. And it was just this like sense of impending something.
Yeah.
I had a friend move in with me during that time and we kind of joke about it now in retrospect, but we didn't know what we were getting into. We had friends in other parts of the country and other parts of the world that were in healthcare that weren't doing well with it, either personally getting sick or just the stress from the work side of things. I have colleagues that committed suicide or died from it. It was a process that we started seeing these things and we just had I don't know, maybe we die in the next 6 months.
Man.
And so we kind of dialed in nutrition, oddly enough, because what we'd talk about was the work stress and we both really like to cook. So it was a time that in retrospect was really a special time because it was a wonderful friendship that came as a result of that. But it was also sort of a moment of some deep dive into how we felt like from a casual existential despair standpoint. Yeah. How are we dealing with our lives and what do we value from a purpose standpoint? And if we make it through to the other end, how do we maybe want to live a little bit differently?
Wow. Did that sort of then serve as a basis for where you started looking into like disease as that precursor to disease?
That was a big sort of transition point for me. And then I'd also be remiss to say that an older sibling of mine died about 10 years ago. And I remember being in the room before we went through care and the physician was talking, and I feel terrible for him as a physician. We were not it's an intimidating family to walk into. A couple lawyers, couple doctors, various stages.
Yeah.
And unfortunately, for better or worse, whatever else that man had going on that day, he took the easy way out and didn't really have the discussion. And so the loss of the sibling kind of empowered me to take a look at my own life and say, hey, where else can I draw a little bit more value? What matters? What doesn't matter? But then also the willingness to have discussions with people from the patient care side of things. So those were two things I took from that. Marry that with the COVID scenario, and you're absolutely right. This was something that was a profound moment in my life, both of them, to sit here and say, hey, maybe there's something I need to just sit and think about for a little bit. Maybe it's not just the hustle and bustle and the chaos. Maybe there's a moment to actually learn a lesson from this. And then maybe that's the missing thing for feeling like I'm spinning my wheels in the healthcare practice.
Yeah. So then let's go into, and I think we both shared that frustration with, on my side, with conventional, we call it big box PT. It's like, everyone knows this in our audience, 4 to 5 patients an hour. They're doing really just to be honest, a very subpar care. And for me, it just gives a bad name for physical therapy. And maybe, in some sense, there's a bad name for medicine, which is unfortunate because I think in both of our professions, we have a lot of people doing the best they can, but the system itself doesn't allow us to do what we need to do. Right. Coverage isn't there for insurance carriers and whatnot as well. And so I found that with conventional PT that not only was there subpar care, but for our particular clientele, which is runners and lifelong athletes over 40, a lot of these PT practices would just not have the time to address the root cause or figure out what is below the symptoms. And so they just ended up putting basically Band-Aids on these issues.
Right.
And you've been very honest about your frustrations that you've had with conventional medicine. Where have you seen those gaps and what are your own frustrations with conventional medicine?
Yeah. I think I always think of a mentor of mine when I was both a medical student and a resident. And he had this very profound saying. I didn't really catch the depth of it until later in practice, but he said, and forgive my French for it, if you have a headache because someone is hitting you in the head with a hammer, do you take a pill for the headache? No, you tell them to quit fucking hitting you in the head. And at first I thought oh, that's a hilarious little joke. But as I noticed going through my own practice with healthcare, that really is what we do. As you mentioned, the Band-Aid prospect, that's really what we do. And I don't think it's some grand conspiracy theory. It's not a bunch of healthcare providers that are taking the shortcut. It really does feel systemic in some sense. And what I mean by that, if we take a nutrition system, for example, we eat fairly low quality food for convenience purposes. We have pharmaceuticals that are produced as maintenance medications. First off, there is no medication that I'm aware of that actively regenerates health. Most of the medications that are coming down, you maybe say that antibiotics cure an infection, but they don't regenerate health.
Yeah.
And when we talk about cardiovascular disease, we talk about, cholesterol, we talk about diabetes, all these metabolic syndromes, a lot of the autoimmune things. These are things that are maintained by medicines, but they're not changed. They're not reversed. They're not improved. There's nothing that regenerates. And that was a really frustrating thing, because I think when we sit here and we talk about a billing model for healthcare that is based on interventions, diagnoses, and either prescription or procedural processes, that doesn't leave a whole lot of things for let's talk about it and figure out what's upstream, AKA the hammer. Is it the hammer that's causing the headache, or is there something else going on here? And when we live in this sort of fast-paced convenience style, we don't sleep. We've maybe lost touch with our purpose and our hopes and our dreams, because those do matter as people.
100%.
I think there's something to be said for purpose. We're not as active as we should be. We have these sedentary jobs, and we feel constant stress from the notifications, all of the little things that come up, traffic, all the things that come up on a daily basis. We're not really inclined to figure out how to sort those things within the healthcare system. And that causes us to feel bad. And as a result, people come in feeling bad.
Definitely. And it's funny you say that, because there are, as I think about it, as you're talking, there's so many different causational things out there that can really influence, impact our general health and well-being,
right,
on a day-to-day basis, like you said.
Yeah. I think that's a really powerful thing. And I mentioned the idea of dis-ease a little bit earlier. Maybe this is a good moment to talk about that just for a moment. So what I started noticing is medicine, conventional medicine, the healthcare system is great about treating disease. Maybe not treating, unless it's like trauma, break a bone, you get it fixed or stabilized. You have a thing that needs to be cut out, fine. When you talk about actually doing something beyond that, though, we're not terribly good at looking at, again, I'll say the upstream thing. And so I noticed a lot of people that aren't coming in with disease, meaning they don't have abnormal labs, they don't have abnormal imaging, they don't have, an electrophysiologic study that shows something, but they're still in this position of feeling sick. And I think eventually when you're in that dis-ease state, meaning like the precursor to disease, and I think that's a really clever hyphenation on my part. I wish I could take credit for it, but I can't. But if you actually separate the word dis-ease, it's this feeling that something's not right. And I think that's the category that I would label the people with that have had the negative workups, that are out there gaining weight, not sleeping well, feeling like something is wrong, but it's not wrong enough to be able to have something done about it in the medical system. And I'm noticing more and more that's where we are. I remember being early on in my stages, like a pre-COVID era of emergency medicine, and it felt like disease. Active disease was the primary thing we saw. Now it feels like the tables have shifted and it's more dis-ease. It's this precursor to something. And I think those are the areas that can be managed by some lifestyle changes, by some actual sitting and thinking and talking about the root causes that a 15 or 20-minute office visit does not allow for.
I love how you said that, because definitely agree that I've met more people in my age group, 40 and over, where they are saying exactly what you're saying, Chad. It's like, I went to the doc because I wasn't feeling great. All of my labs are negative. I'm not really overweight, but I don't feel like getting up in the morning. All these different things, and I don't understand what's going on. And so there's a lot of frustration, and I would even say there's more worry and anxiety, because maybe there's something really sort of happening that I'm not aware of, that these tests don't pick up. And so they're left at a loss of what to do. How do you guide someone like that who's coming to see you and it's like, hey, I don't know what's going on, but I just don't feel right?
Well, I think the anxiety part that you mentioned is really particularly interesting, because a lot of times it fuels this sort of detachment from the conventional medical system. And then some people take on the independent research process. Maybe they're not qualified to do so. So now all of a sudden there's like WebMD, you're automatically dying or it's cancer. It's on TikTok or, Instagram. Your like neighbor's sister's dog walker is a gut health specialist on there. And you get all this fear mongering that goes on that then fuels that idea of, oh my gosh, there's something going on. And so the first thing that I have first thing I'll talk about from a client basis when people come in to see me with that is getting a baseline. Like, I want to know where we are. What are you eating? What are you doing for activity? What are you doing from a rest standpoint? And I think rest is a really interesting thing, because we all know like we need 6, 7, 8 hours of sleep. That's fine. But I think humans we're active in 3 ways. We're active physically, we're active emotionally, and we're active from a mental standpoint. And I think there should be correspondingly 3 types of rest we get. We need physical rest, we need mental rest from a cognitive standpoint, and we need that emotional rest as well. And so a lot of times it's maybe making addition by subtraction is a good way to do it. It's what are we able to say no to? Like, what are the things we can offload in our daily lives that we don't need, that aren't productive, and maybe aren't that helpful to us, that are causing us to feel bad, take on additional stress? And so initially, to answer that question in brief, is it's a baseline, and then we start to remove the extra things that are not actually adding to your life.
I love that addition by subtraction. I think we're so used to adding, even let's talk about supplements.
Mm-hmm.
Well, if I take these things, maybe I'll feel better. Maybe that's not the right way to go.
Yeah. And I think that's such a common thing from a medication standpoint too. Yeah. Let's say you've got high blood pressure, so your doctor starts you on a blood pressure medicine. A lot of the first line of blood pressure medicines are diuretics, so you pee more. If you're a little bit older, the pee thing gets to be pretty frustrating. Right. So they put you on something to help with that overactive bladder. That gives you anticholinergic side effects. Now you're taking a medicine to help with that. You're depressed from how bad your health has fallen off in the period the past few months. Now you're taking an antidepressant too. It's really easy to see how I call it getting caught in the healthcare wheel.
Oh man,
it's all well intentioned.
Yeah,
but by the end of it, you may come out with like 6, 7, 8 new things
that you didn't come in with.
Right, and are we helping people when we do that? And it's not to say it's a conspiracy from the doctor's standpoint, but I think some specialists are so focused on their niche that we lose the forest for the trees. There was a wonderful article I remember reading in medical school that was called The 7 Blind Doctors and the Elephant. And the elephant was death. The elephant is a patient who has maxed out their health. They've maxed out their time on earth, but the cardiologist comes and sees something cardiovascular they can fix. The nephrologist sees something from a renal standpoint they can fix. The internal medicine doctor comes and sees some specialist he can consult that's not been involved yet. The neurologist comes in and sees a cognitive process that can be like maintained or something along those lines. And it takes the nurse coming in, the person who sees all, to say, guys, you're dying. And that's okay.
Yeah.
But we lose that sometimes, the forest for the trees in healthcare.
That's crazy, man. What I found to be the case also is that sometimes people just wait too long to get care done. So I would love to help our kind of clientele to stay ahead of things. And, I don't think that people prioritize things until it's too late sometimes, or they've ignored things long enough and now something's finally becoming urgent. What do you think we can do to help people to understand that, hey, it's not about treating something when it happens, it's about trying to stay ahead of it?
Right. But I think, it's that ounce of prevention, pound of cure thing. And maybe this is coming, this is a radical thought, jumping out, that was a Freudian slip. This is a very radical thought. Maybe it's about thinking about the downstream ramification of it, right? If we wait until it's a problem, the cat's out of the bag.
Yeah.
Once it's a problem, you're going to go down the conventional medicine route, and it's hard to reverse things past a certain point.
Definitely.
And maybe this is the thing I've been thinking about lately is there's so many experts out there right now. Everybody's an expert on everything in 2025.
Yes.
Maybe it's time for us to become experts on ourselves. And in the process of how easy it is to fall asleep in our individual lives and go on autopilot, maybe it's time to come back home to ourselves and take a little bit of time and say, hey, I haven't felt great the last week or so. I've been having these headaches. I've been having this racing heart and racing thought sensation trying to sleep. That's not something just to put on the back burner and say, oh, well, it'll probably get better. And it's not something to make a crisis out of either, but it's time to sit and think a little bit and say, hey, let's take some note. Let's maybe do a little bit of some journaling about this, and not journaling in the woo-woo granola sense, but take a look and see if you can identify triggers. Take a look and see what fits for you in your life. And I think a lot of times we're undervaluing ourselves and our experience as people because we're told that the knowledge is in somebody else.
That's absolutely true. It's funny. One of the first things that we do with clients coming in is we take them through our total body assessment, we call it. And it's basically a discovery visit. And it's funny because people don't sometimes understand and we'll get to this later with the pillars, but they don't see the level of impact that what they do on a day-to-day basis can contribute to the reason why they're always injured, the reason why they're not able to perform at their very best. Is that something that you also see in the clients that you see?
I think absolutely. And in part, I wonder how much of it is the rush. Yeah. I'm going to butcher it just a little bit, but there was a quote from the Dalai Lama that I absolutely love that talks about, I guess he was asked the question of what surprises him most about humanity. And it's this idea that in our rush to grow up, we forget to act as children and enjoy our youth. We have this rush to make money, and we sacrifice our health to do so. And in the process of having sacrificed our health, by the time we have money, we can't really enjoy it. Yeah. And so we end up in this position that we're, neither really present in this moment. We're thinking about the past or the future. So we're not living. We're asleep at the wheel. And then we come to the end of our lives and it's like, well, gosh, what happened? The time ran out. And I think it's that fear that the time is running out. And while we're so preoccupied about the time running out and not getting into our to-do list so that we can finally be happy, because everyone waits for that moment, it seems like, we're not happy in the moment. And when that comes, what I noticed from the patients, this is something that I think maybe it's a good time to unpack. I had a lot of my further solidifying my view about these things, hearing from patients that were dying in the COVID era. I spent so much time and so many conversations with people that had reached the end of their rope and realized that they were waking up and they didn't have more time in their hourglass of life. And they told regrets that were about spending more time with people they loved. It was about having missed the opportunity to go to their children's athletic events or academic events when they had the opportunity to do so. It was about maybe wishing they could have forgiven or had the hard conversation or not held the grudge or been so quick to anger. It was never about oh gosh, I wish I'd worked more overtime shifts at the job that never really cared about me in the first place. And I think there's something to be said as we're all rushing for the finish lines of our lives. Maybe we have to back up and be present for the moment. And I think that extends back to the original question of how do we take inventory of that? Do that on a daily basis. If I wake up enough days in a row and I don't like what I see in the mirror, I don't like how I feel, that's a sign that I need to change something and identify what the problem is.
That's powerful. And I feel like you're preaching to me right now.
No.
And the reason why is because I just turned 50 2 days ago.
Uh-huh.
And it's funny because I had this day of just reflecting on things and whatnot. And what I realized is I had these goals and grandiose goals of having X number of locations by a certain age and whatnot and whatever. But I was reading this book actually called The Ruthless Elimination of Hurry.
Ooh,
and so
I love that title.
Actually kind of triggered something there. But I realized that, as much as I want to hit these goals, and to your point, if I don't realize that I have my family, my wife and my kids who are there for me, but if I'm not spending time with them, and if I'm just worried about getting this, going this basic rat race, my own self-created rat race, if you will, I am missing out of what's happening in the present. And so it really made me pause on things. And what I've done the last couple of days, and I hope to continue for the rest of the year, is say, okay, this is the goal, but can we add or can we subtract, I should say, some things from my day-to-day that I can either give to other people on my team,
right,
or I can actually just say, this is not important enough for me to invest my time and energy into.
Exactly.
Where I can now move forward more carefully, cautiously, so that on a day-to-day basis, I don't lose that time to take that inventory of how I'm actually feeling.
Exactly.
So
I think that's such an important thing.
Yeah.
I heard this thing on the Instagram the other day that was, I forget who said it, but it was somebody talking about the best version of ourselves is not the go anywhere, do anything at all times version. And I think we're taught to be like open-minded in a sense that it's almost pathologic. Like, you should do anything. Yeah, you should have, like, whatever the thing that sets your heart on fire, do that. But we have so many opportunities to do things on a daily basis. If we say yes to all of them, we're completely overwhelmed. And so the best version of ourselves is not the version that says yes to everything. It's the one that says, I don't do that past this hour. I don't drink that. I don't hang out with these people. It's the one that has the priorities in our own internal compass and says, this is the things that I'm willing to spend my time on, my family, my friends, my occupation, my passion, etc. And the rest of those things, if I have time for it or on a special occasion, that's amazing. But we're not doing it every day.
Definitely, yeah. Let's transition into talking about Maven Growth, because I want to have our audience really hear about this. So tell us about your company, Maven Growth, what it is, what makes it different from what people usually experience with doctors, trainers, or even wellness coaches.
Sure. So a lot of it is what I would call like lifestyle optimization sort of processes. It's coming back to understand that we can generate health, not through medications and procedures, except for sometimes those are actually medically indicated, right? Like you get to something, again, break a bone, trauma standpoint, there's other scenarios too, but like you actually need to go to a doctor for that. I'm not the person to come talk to if you have undiagnosed chest pain that's not been evaluated, right? But if you have evaluated chest pain and you have these things in your life that are imbalances and you want to reset those, if you're noticing that your health has been sliding, your weight's been gaining, your waistline's increasing, your sleep's deteriorating, and you've been medically evaluated and those things are fine, Maven Growth was my solution to help those people that fall through the cracks of conventional healthcare. And what I mean by that is it's returning back to some pillars of health. For me, pillars of health are exercise, nutrition, sleep, rest, and some aspect of spirituality or higher purpose. I think if we focus on those 5 areas of our life, and I understand that life has seasons and that sometimes we're not able to fill all 5 of those buckets up maximal capacity simultaneously all the way through. There's times where we have to prioritize a little bit of our work. There's times we prioritize our family. But I think real health for me, real health, not just the sick care maintenance system thing that we have, is about being able to keep as much of those buckets full as possible as we move forward in our lives, keeping the attention on what actually matters, letting go of the rest, and using, I see this lovely quote on the wall, movement as medicine, using movement as medicine, using food as medicine, using rest, recovery, and spirituality, and whatever your God or whatever you believe in, but not forgetting how important those things are to live a life that is cohesive.
I love that. Can you walk me through like what a session might look like working with you?
Yeah. So for right now, I have essentially like a built out exercise nutrition program. And I think nutrition is something that is not this one size fits all sort of thing. And so is exercise. So these are all highly personalized. We have discussions on a weekly basis, either through one-on-one sessions or through group coaching calls about how to kind of optimize the process as you're going through it, what comes up, what battles do we fight along the way. And because, right, like this is a process where I'm asking folks to spend the time and do the work. My program for Maven Growth is not the quick fix. It's not a magic wand that we can wave it and undo 15, 20 years of like relatively poor choices.
Yeah.
It is a solution that for somebody who is ready to do the work and ready to unpack and ready to actually take a look and is not afraid of what they might see in the mirror as some negative things come up sometimes. It's a process to work through those things and build out what I would like to think is the best version of ourselves. And I know it works because my clients have had success with it, but it's also the thing that changed my life. When I was in a situation that I was going through healthcare and I had reached sort of my limit of what I could handle from it, I was a disgruntled, burned out employee that wasn't really showing up for myself or for the corporate things. I had to take a step away and say, where am I slacking? And where I'm slacking was exercise, nutrition, sleep, recovery, spirituality, purpose. And when I came back home, I recentered on those things. I started to feel better. And when I started to feel better, people noticed the change and they started asking. This was never my intention to bring Maven Growth and say, I know more than you do. I don't. There is no quick fix. There is no one size fits all. But for people that identify with the process of doing some work from a physical, spiritual, and introspective standpoint to really sort of evaluate where they are in life and make some improvements, I built this program for those people.
I love that. It really does mirror what we're trying to do with Physio as well. And with our clients over 40, to heal, recover, perform at their best version.
Exactly.
And at any given age, every year is going to be a little different, right?
And it's been such a blast over the last, since we've introduced through Instagram and kind of connected there, to mirror your content and see how we align in those things. Like it's been fantastic. Like I love that this is a movement that's not just in the healthcare area, not like in the emergency room hospital area. I love that there's somebody in the physical therapy space because these things are so important.
Oh, absolutely, man. And I would say, one of the quick curiosities that I had was, and I love that, having a physician background, it's hard. I would say that physicians like you are very far and few. You don't meet a lot of physicians, or I haven't met a lot of physicians who are as much in shape as you are, or really prioritize all the other factors, the core pillars that you mentioned as much as you do.
Right.
So it's been refreshing to meet someone with that other perspective.
I appreciate that.
Yeah. So, with blending your medical knowledge with performance optimization, how does that show up with how you're working with your clients?
Yeah. I think one of the things that the medical education system does a bad job of doing is teaching about health. We are really good about diagnosing disease. We're really good about intervening within the confines of healthcare capabilities on disease. But you ask most doctors and they don't know a whole lot about health.
That's interesting.
And that's a really funny sort of standpoint because a lot of the times, I think if you're going to be a leader of some sort, meaning you influence other people in some way, whether that's as a physician, as a business manager, as an owner of something, your weakness is everyone else's excuse. It's their way out. And so when you show up to talk to your doctor and they're 150 pounds overweight or 50 pounds overweight, or they're talking about the medications that they're on, it's the same medications you're on, that doesn't really, for me, instill a whole lot of faith that they know anything about health either. And it's so easy to allow our health as physicians to slide because we work long hours. We're taught in a system to say yes to all opportunities that come our way. We're taught to prioritize everyone over ourselves. It's easy to let health slide in that way. And so what I found is when I talk to my colleagues about this idea, they say, yeah, that's great, but like, what is health? And that's sort of an interesting thing to me. And so I think my background, I grew up as an athlete.
Yeah.
Through my older brother that died, he was a chef. And so it was a wonderful opportunity to learn from him how to cook. And then after his death, we had this hole in family gatherings and somebody needed to cook for those. And I always had a real passion with it. And I traveled a lot when I was younger and before I could speak Spanish in the host families that I was with, oftentimes food was the thing, it was the icebreaker. It was the thing that like when we couldn't really communicate, we could all get around a meal. And so food has always been a really special part of my life, which goes directly into nutrition.
Yeah.
And then one of the things that really helped me through the dark places in medicine as I started to get more depressed, but hadn't really figured out a solution to it, I started with dance. And dance was a moment of just like unbridled self-expression. It wasn't for anybody. I wasn't trying to compete. It was just this opportunity to take a look and see how I felt about me, which led to something that was purpose related. It led to an idea of how to let go and sort of de-stress. And so all of those things came together in my background that I started to feel like I actually was learning a little bit about health or what it meant to be like an optimized, like well-functioning, happy, situated person. But I don't think it's a complicated recipe. And maybe that's the thing that we think that it's just this other thing. I just need this other sort of scenario. I need this quick fix. I need somebody else's expert opinion. And maybe we need, again, the addition by subtraction thing. Maybe health is about doing a little bit less, but prioritizing the important things.
I agree. And it's funny because in a first world country like ours, where we have access to all these different ways of being healthy,
Right.
that we don't, society at large doesn't actually pursue these until it's too late.
Right. And I wonder about that. You know, I wonder how much of it really is the convenience aspect of things. I saw a quote the other day that I really, really liked that was along the lines of whatever the easy thing is, understand that has a downstream effect. If you're choosing convenience on a regular basis, you are sacrificing your health, you're sacrificing your wellness. And that's a really uncomfortable sort of thing. You know, we have a lifestyle that is built for convenience. And from an evolutionary perspective, when we were, you know, still out sort of barely scraping by from a survival standpoint, we wanted the comfy bed, we wanted the high fat, the high sugar, the things that were easily
accessible.
Those were few and far between. And so there was a fair bit of strife that we have ironed out, and it's amazing that we have ironed out the majority of our truly difficult aspects of living as humans. But one of the interesting things about human psychology that I've noticed over the years is even if you have the best life from the Instagram, like photo standpoint, you're driving the nice car, you live in the big house, you've got people that cook and clean, you still have problems. And those little problems, they eat you away just as much as the big problems do.
Definitely.
And so this idea of maybe there's something to be said for putting ourselves in uncomfortable positions, doing the work.
Yeah.
I really dislike running. I know that it's a basis of your PT standpoint. I went for a run earlier today because it's something I truly dislike.
Hey.
So, you know, and not to say, yay, go me, but it's about putting ourselves in some uncomfortable positions sometimes to figure out where we can show up better for ourselves.
You know, I love the convenience-driven lifestyle you mentioned. And I do feel that because it's so easy to have things done for us and whatnot, there is this lack that I see sometimes in younger generations, and maybe even, you know, people our age as well, well, it's my age anyway, where because things are so easy to access that we've lost the art of doing hard things. And to your point where, you know, maybe running something that you don't necessarily enjoy, but something that you know you should do and you're doing as a result. I also, by nature, I mean, I took a break from running because I wanted to get stronger and work on muscular development. And what I found was that when I got back into running, I actually didn't want to do it. But then I was like, I was like, you know what? There's some value here of just doing something hard for a long period of time. And for anyone out in our audience, if you're used to doing easy things, my challenge, and I think Dr. Chad's challenge too, would be to pick something up, pick up one thing this year that maybe you have avoided, and maybe it's physical activity or something like that, or eating better, and make this something that you can maybe focus on this year to get better at, so that it does then help you to handle things that are not as easy on a day-to-day basis. It'll help you to create that resilience that you might be looking for, and you might be surprised by how it actually might help you in different ways you haven't imagined.
I think that's an incredible challenge, and to echo that sentiment, a lot of times people are talking about, oh, I want to get in the gym and I want to get fit. It's not so much going to the gym, it's the person you become when you go to the gym on a regular basis.
Exactly.
You know, it's not so much just the six-pack abs or the feeling a little bit more toned or muscular. It's how you learn to deal with problems and the belief that you have in yourself because you did a hard thing. It's so much easier to come home after a day of work and you're exhausted and order the takeout and sit on the couch.
Yeah.
That doesn't make you a better person, though. And I think life is a lot like riding a bicycle. It's either forward or back. There's no maintenance other than maintenance medications, but they don't really maintain it. They slow the progression of it.
Yeah.
And so when we stop, we generally tend to fall over, right? On the bicycle of life, so to speak. So it's forward or back. You choose which one, but every day we make a choice.
Yeah, definitely. You know, you talked about cooking, and one of the things, something I enjoy as well, one of the things that when I, survey our clients, it's an area of struggle, nutrition.
Oh my goodness, it
and
is.
It's funny because you would think that people performing at a high level, runners, elite athletes and whatnot, they would have the nutrition down, whatnot. They seem to look healthy on the outside. And then you go into their history and they'll, I'm always feeling tired. I don't feel like I used to. And then you ask, well, do you track your macros at all? Are there any surprises that you saw there too, maybe working with some of your clients?
Oh, absolutely.
Yeah.
I have a lot of, it's very common for some of the, again, I think you mentioned it really well from the high achievers sort of standpoint of, these are athletes, these are executives, these are people that have access to resources and knowledge. They're not just like showing up with nothing. And they tend, oh yeah, I eat well. And then we start to unpack that and it's like, oof. And, I'm not somebody I don't count my macros on a daily basis, but I've gone through years of my life where everything that went in my face was counted. And from that standpoint, you learn how to approximate on a pretty accurate basis. And it is very interesting where things are hidden. Either the snackers or the grazers, those are the ones in particular that pop up. Oh my gosh, how is my carb and fat content so high? And I get like 60 grams of protein on a daily basis. And it's really curious to me because, again, as we get, and you mentioned a lot of your clients are over that 40 age group. As we get when I worked out in my 20s, it was about like, how good could I look when I took my shirt off, so to speak,
easily.
Right? But like, as I get a little bit older and I see the healthcare part of this, what I see when I have patients in their 60s and 70s and I get imaging studies is they have no muscle mass. And every now and again, you get a really active, like 60 or 70-year-old that's a triathlete or a cyclist or a rock climber, and you get the imaging study and the side-by-side comparison of the inactive versus the active, muscle mass is tremendous.
100%.
When we talk about bone density, that's a big thing in women's health. My understanding, one of the scariest facts I learned in medical school was that bone density declines by about 7% per year after menopause. Once you have the estrogen withdrawal, bone density goes down. The only thing to do to reverse or to slow that is resistance, load-bearing exercise. Muscle mass, same thing. Past our 30s, if we're not actively building it, we're losing it. And as we get older, it's really a discussion about independence. It's how do we live as long as possible and do the things that we like that add value to our lives as long as possible. It's not so much the take the shirt off. That's great. That's a secondary gain thing. But that's not the purpose of it. And that's a really sort of interesting paradigm when, like, no, you have to follow the protein. You have to follow the macros, at least in some sense, because that's the baseline that lets you get to this final destination of living longer and doing the things you like doing with the people you like doing them with.
Absolutely. There's obviously longevity is something that you and I are both achieving for ourselves and for our clients. And I did an episode actually specifically on longevity in runners, and the three main variables, which actually several variables, but the three main ones that I thought they can control easily are the nutrition, adding strength training, because a lot of runners, they don't do that. And they look at strength training as this, oh, when I have some time, I'll do that.
Right.
But to your point, where if you're losing muscle mass, and with endurance sports, you tend to lose it maybe even faster, I would say, it's so important for runners, endurance athletes out there to be adding that into their regimen.
Exactly. Just, and adding that in. It doesn't have to be this like crazy, and maybe that's where we all go wrong with it, is the idea that like, oh, I've got to have like, I got to do it all. If I don't fill the cup 100%, I've failed. It's like, no, it's small steps on a consistent basis. If you show up and you're consistently average for enough days in a row, you just do a little bit of it.
Absolutely.
That is massive progress by comparison to the people that like feast or famine, they go all in and then lose it because they didn't really build a foundation that was able to maintain.
Absolutely. Yeah. What are some things that also might have surprised you about what people get wrong in the performance wellness, as far as what it means to be healthy?
Yeah. I think we've just forgotten what it looks like. We're so inactive on a regular basis for the majority of people to have desk jobs. We're so used to having other people cook our meals. And so we've sort of fallen asleep. If you don't know what's in your restaurant food, and it's impossible to, the same plate of food may have 12, 13, 1,400 calories. When you take the same things you make it at home without the oils, without the additives, without all those things, we're talking 500, 600 calories sort of things.
Great.
If we're going to work on the regular basis and your notifications are going off all the time, you're never really separating yourself from that. There's never any recovery time for it. And it's amazing how often we just get lost in the process of putting out the next fire of our life. And maybe by extension, waiting until that to-do list of fires of must get done is done before we allow ourselves to feel happy and successful. I don't know about you, Jerry, but like, I imagine your to-do list is pretty long, right?
Yeah.
How often do you get to the end of it on a daily basis?
Rarely ever. Yeah.
It's same here, and so I had this realization, if I can't get to the end on a daily basis and I'm allowing myself to be frustrated by what's still needing to be done, well, I'm going to spend most of my time unhappy.
Yeah, very much so.
If we can be unhappy for no reason or have a bad day for no reason, why can't we have a good day for no reason?
Yeah, I like that. So when you've helped a client, walk me through this. So they started working with you, they've gotten calls with you, they've been working through your program, getting their nutrition optimized, maybe exercise as well. what does maybe an end result look like as far as like what a client should expect, or maybe some like stories that people have told you, oh my God, I've never felt fill in the blank.
We had, I think there's the aesthetic things like, oh my gosh, the jeans that I wanted to fit into, I finally do.
Hey.
We have some life things of, wow, I feel better. I have better energy to show up with my family. The time that I have at home, I'm actually spending at home instead of thinking about being at work. Had one of my clients tell me, like, I've taken a laxative so that I can go to the bathroom for the last 10 years. And now that I've gotten my nutrition kind of straight, I don't have to do that anymore.
Yeah.
I've had clients that are able to reduce or come off some of their medications. And it's really remarkable to see. Those are rarely, those ones, the laxatives, the, medications, the better energy, those not always the first tier motivator factors. Sometimes it's for the glitzy thing. It's like, I want to fit into the clothes from before I got pregnant, or I want to get back to the body that I had in college. But back on the point about it's who we become in the process, we have these other things that the journey builds up in us. And it's been really, really, really special to sort of hear those as they come out and have clients say, I didn't even think that was possible. And then what's the version of them that can prioritize what sets their heart on fire? Like what is the higher purpose that they're able to live for when they realize what actually matters in life?
That's crazy. So it's almost like this, if a winding to word, but you're almost like letting layers come off to where now you can help them to figure out what it is that their purpose is from working on their health.
Right. It's amazing. And I think that if you have a job that you don't particularly feel engaged in, or you don't particularly like, you don't particularly sleep well, you don't particularly eat well, you don't really exercise or move on a regular basis. Well, there's so much negative in your life, it's hard to really separate the signal from the impulse and figure out what's causing you to feel sick, if everything is causing you to feel sick. But when you start to like peel these layers back, just like you said, it's amazing what's actually underneath there. You start to figure out how things work for you and what nutrition works for you, what exercise works for you. And it's like all of a sudden, oh my gosh, like I can do all these things. I had no clue I actually felt this bad. And we get so used to feeling bad that we accept it as our normal.
That's crazy, man. One of the other thoughts that came to mind as you were talking about the results that your clients get is you almost have to sometimes give clients what they want what they want so that they can actually find that there are things that they need that
exactly,
are addressed.
And I think that's a really funny thing about the paradigm for like preventative care. It's not sexy. It doesn't have the appeal for most people to want to spend time and energy on it. And there's also a lack of understanding for why we need to spend the time and the energy on it.
Yeah.
And so the ounce of care and, or ounce of cure and ounce of prevention, pound of cure sort of paradigm, sometimes the ounce of prevention isn't appealing enough by itself. It has to be wrapped in a different layer. It has to be presented in a different way. But I think it's so important to come back and say, well, what can we undo before it becomes a real problem and the ship sort of leaves the harbor?
Definitely. And, Dr. Chad, as we're getting close to closing, and we probably touched on many elements, if there was like one change that you love to see in the way that our society at large approaches health, especially for those who are just functioning, maybe barely sometimes, but not thriving, what's that one change that you would like to see happen?
I think this comes back to a Jim Rohn quote that I heard recently, and I love it because we have a paradigm in our society that we should take care of each other. And he said, and it's not, I'll take care of you if you take care of me. It's I'll take care of me for you if you take care of you for me. If we show up better in our own lives, and I know that's a hard thing to do because we feel like we have so many responsibilities, so many other priorities, but if we show up better for ourselves, a lot of times that gives us the potential to show up better for everyone else.
Definitely.
That's how we make our lives better. That's how we make our communities better. That's how we make our families better. And I would love to see a little bit more purpose and intent in that area, building ourselves up rather than just having the chronic beaten down process that I think so many people are in right now.
It's funny. You remind me of a point in my life when I was just starting on Next Level, and I had lost sight of my health first, similar to when you had that period of time as well. So I was overweight, not sleeping well, stressed out of my mind, getting a practice going, and, seeing the savings go dwindling down.
Right.
And it wasn't until I started taking care of myself that things started to explode.
Right.
And so you reminded me of that time in my life where I had to make a change for the better for everybody, for my wife, for my kids, and for my business.
Right.
And as a result, living what I preach, and you as well, what kind of impact that's had on our patients and our clients as well.
And I think that's such a wonderful way to put it. When you lead by example that way, it works. You're not out here showing some exercises or something that you haven't done the time and the energy in. You've done the self work, you've done the physical work, you've done the life work. And when that comes together, it gets people's attention. It makes them want to see what's going on over there and how can we learn from them.
Definitely. Love that. So Dr. Chad, thank you so much for coming on our show. I learned a lot more about Maven Growth, which I'm really excited about. For anyone out there who is looking for a physician who actually practices something other than just medicine and can really give some great insights into your health and how to optimize yourself, I think a lot of our clients are in the same category, active, over 40, are really at a point in their lives where they want to start making some change. Dr. Chad, what's the best way for people to either connect with you or to reach you?
2 ways, probably the best way. One is Instagram at the Chad Burton. That's where I'm active there all the time. And then we also have a website, mavengrowth.com. It's down this week for a little bit of some reparations, but it should be back up in the next 2. So I'd imagine by the time this comes live, it'll be back up and functional.
Awesome. I'll make sure I put those in the show notes so people can find you.
I love it. Thanks, Jerry.
Thanks so much for coming on the show.
Absolute pleasure. Thank you for having me, man. I truly enjoyed it.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least 1 or 2 helpful insights or takeaways to help you get to your next level.